Okay guys, GI and vascular anatomy. So very briefly, let's just appreciate the fact that we've got the foregut, midgut, hindgut, each supplied by the celiac artery, the superior mesenteric artery and the inferior mesenteric artery. Appreciate the vertebral levels of each of those guys. We need to know that. Absolutely imperative. Moving on to the actual branches of the superior mesenteric, inferior mesenteric, and how do we remember those? Easy way to do this. It's and it's just a matter of understanding a little bit of the anatomy, appreciating that. So first and foremost, let's identify we've got a patient on the table in the anatomical position. Therefore, this side is the right hand side. We start everything on the right. We examine the patient from the right side of the bed, etc. And then we got the left. What have I got here? This picture here. Well, the picture here essentially is your colon. And what I've done is I've said you've got your transverse colon, your descending colon, and your ascending colon. You'll therefore appreciate that on this side here we have the cecum and the ileocecal valve, and on this side we've got the sigmoid. Okay, and all of this becomes very relevant in just a moment. So let's now go into the actual vasculature itself. We've got 3 branches on each side. Okay, so if I draw a little line there, 3 branches on each side. Let's go with the middle branch first. And what are we going to supply? Well, we're going to supply the colon. Hence, it's a colic artery. And on both sides, we've got this colic artery. Well, this one's on the right hand side, so this is the right colic artery, and this is on the left hand side, left colic artery. Next, we'll go and look at these 2 structures over here. Well, this is going to the cecum, and we said the ileocecal valve, and therefore this is your ileocolic, because again it's the colon. So ileocolic artery, and you can spell that as I-L-E-O or I-L-I-O. And in a similar fashion on this side, lo and behold, we have the sigmoidal artery, because it's supplying the sigmoid. It's fairly straightforward. Last but not least, we've got the branches at the top. And this is where it's slightly different. The only memory bit you've got to do is that this is the marginal artery, and on this side we have the middle colic. And there's no real way to remember that except to say, well, actually the middle is kind of going towards the transverse colon, which is the middle of the colon, as compared to the right and the left, and therefore this is your marginal. Well, I hope that helps. That's kind of the easy way to remember the branches of your superior mesenteric and your inferior mesenteric. Thank you for watching.